Hi, how are you?
I've been better.
Well, I know it's been 3 months since your last visit here. Bring me up to date on things.
Oh my gosh. Dr. Whitmer, the pain is so bad and it's making me have panic attacks because I can't do anything. I want to go do things, but I can't do anything because my pain hurts, and I try to go outside and I can't go outside because I'm having panic attacks, and my mom is trying to take my house because I don't have a job and everything. It's like, and there's just, I can't.
Oh, that's okay. Here, take one of these.
Thank you.
Okay.
Okay. Alright. I'm sorry. I usually keep it together,
That's okay.
but okay.
Well, let's start with your pain. Tell me about that. Where's your pain at?
I think that my pain's the problem. It's my back. Because I had that fall off of that ladder like 10 years ago, and I think that that's what it was.
Okay.
And it just got worse and worse and worse, and I can't stand it anymore.
Now, I know that when you came to me for the first time as a new patient here about 6 months ago, you had been on Norco on a pretty much continuous, regular basis.
Yeah.
When did you start that medication, and what had you
Yeah.
tried before that?
I've been on Norco for a long time. It's the only thing that helps. I tried the ibuprofen, muscle relaxers. I tried going to a chiropractor. That didn't really help. And started taking the Norcos back in the 90s.
Yeah.
And it takes it down from like a 12
Okay.
to like a 7.
Okay. Have you had to take more and more of that as time goes on?
I think they bumped me up because I was taking the 5s for a while, and I kept working, and then they had to bump me up to the 7s, and then they had to bump me up to the 10s, and then my back still kept hurting, so I couldn't work anymore.
Okay.
So
you're on disability now?
Yeah.
Okay.
Yeah.
Okay. Have you had any problems with side effects from that Norco, like excessive drowsiness, constipation?
I don't think so.
No. Okay. Have you ever had X-rays or an MRI scan on your back?
I think we had X-rays. We had an MRI a long time ago.
Okay.
Yeah.
Do you have any pain that's radiating down your legs or causing any trouble with your bowels or bladder control?
No.
Okay, so it stays pretty much just in the low back area.
Pretty much.
Okay, all right.
Yeah.
Okay. Are you self-medicating with anything else other than your prescribed medications, things like marijuana, alcohol consumption, other illicit substances?
Gotta be honest with you, Doc.
Okay.
That marijuana.
Does it help you?
It helps.
It helps? Okay.
It helps.
So you're using a good bit of that? Okay. All right.
It is what it is.
Okay, well, I know you live here in Ohio, so we don't have laws that we're not able to prescribe it yet. It has been legalized, but we don't have the guidelines for it. So no doctor is able to prescribe it yet, as you know.
But soon?
Well, it's probably by the end of the year there'll be some guidelines there.
I bet you, if they prescribe that marijuana, I bet you I'd get off of that Norco.
Do you think so?
Yeah.
Well, have you ever seen pain management specialists for your chronic pain?
No.
Okay. Well, we might want to look into that. There are new modalities out there for treatment of chronic pain, assuming it's not a surgical problem, which we might want to do another MRI just to make sure that you don't have some type of a disc herniation or something like that. But if it doesn't turn out to be anything that a surgeon could fix, we might want to have a pain management doctor take a look at you. So I think what I'll do is go ahead and order up an MRI of your lumbar spine.
Okay.
MRI without contrast. We'll see what that shows, and then we may want to do that.
Okay.
So that's that. But let's talk about your depression and your reliance on the Xanax and where we are with that.
Yeah. I can't get out of the house. It seems like without having a panic attack. I just stay in the house, and my mom is getting mad at me, and that just makes me have more problems because she wants me to be able to do anything. I can't do anything because I try to do something and I start to have a panic attack.
Okay. So you're taking more and more of the Xanax?
More and more of the Xanax.
Okay, yeah. How much of that are you taking?
I mean, so you got me on the 1 milligrams.
Okay, how often?
So I'll take one in the morning. I'll take one at night. Sometimes if I'm having a bad day, I gotta take 3.
Okay, so up to 3 a day. Usually 2, but sometimes 3.
Yeah.
Okay. But it's still not doing the job for your panic?
No.
Okay. All right. When you have these panic attacks, what symptoms do you have?
I feel like palpitations, and it's hard to breathe.
Okay.
And I've been to the emergency room a couple times because I thought I was dying.
Okay. What'd they tell you?
And they told me I wasn't dying.
Okay.
They told me I was having a panic attack.
Okay. So they did all the workup. They checked your labs, and they checked the chest X-ray and the EKG, and made sure it wasn't anything cardiac related, anything like that.
Yes.
Okay.
Yeah.
Okay.
So I'm just crazy.
Well, I wouldn't say you're crazy, but I think you've got some maybe some problems here that we could probably look into. And you've never done any formal counseling that I recall, have you?
No.
Okay. Well, what we might want to do is maybe get some help from a counselor, maybe a psychiatrist, to take a look and see if there's something additional we can do with your medication management. You know, it's probably not a good idea for you to be taking all that Xanax on top of all the narcotics. You know, there's a lot of literature out here recently, and they talk about, you know, the overdose problem and deaths from narcotics, especially when you combine it with those medications like Xanax, Valium, drugs in that class. So we really want to try to get you off of that, and eventually all of the pain medications as well.
Okay.
Okay. So I think what we're going to do is I'm going to go ahead and we'll get you an MRI scan ordered up, check your back, make sure there's not a surgical problem there. And if that's okay, then we'll send you over to see Dr. Soin. He's a pain management specialist, and we'll let him take a look at you. You know, there are things they can do now, such as spinal cord stimulators and other things, and other medications too, that don't involve all the narcotics.
Okay.
And then we'll have you see a counselor, and we'll address the the panic and the anxiety, and see if there's something else we can do for you.
I gotta do something, Doc.
I know.
I gotta do something.
We'll work with you. Now, you know, I know you've had some anxiety and some depression. Have you ever had any thoughts of suicide, harming yourself or anyone else?
I mean, sometimes I just don't want to get out of bed in the morning.
Okay, but have you actually ever planned to kill yourself by taking an overdose of pills or any other method like a gun? Or...
No.
Okay.
No.
So none of that. Okay.
No.
I think you're pretty close to your mom. Is she a good support person for you that you can rely on and talk to?
Yeah.
Okay. She's there for you or not?
I think she's trying to help.
Okay.
I think. I guess.
Okay.
She doesn't like, that I do marijuana, but
Yeah. Well, she's that generation, they're pretty much opposed to that sort of thing.
I know.
Okay, and do you have a boyfriend or other support people, friends, other folks that you can be with that are supportive?
Not really. I just kind of stay in the house, and I have like a cat.
Okay, all right.
Yeah.
And you have a brother too, I think, don't you?
Yeah, my brother's okay.
Yeah.
My brother will hang out with me. He'll come over.
Okay. All right.
Yeah.
Okay, and your dad, is he around to help you?
Yeah, he's around. They don't really know everything that's going on, but I guess, they're there, so.
Okay.
Yeah.
Okay. Well, I think the thing is, too, you want to surround yourself with people that are positive.
Yeah. Okay. All right.
Okay. Well, do you need any medication refills right now?
Yeah, I'm out of the Norco and the Xanax, but I think that I have maybe 5 days left on the Norco.
Okay.
So I think I filled it on the 12th. So I don't think I'll need it until the 17th.
Okay.
And I take 4 a day of the 10s.
Okay.
And the Xanax I am out of today. And
Okay.
Yeah.
Okay. Well, what we'll do is we'll do an ORS check on you.
Okay.
And that just tells us, what you're taking, when you last filled controlled substances, and how many you got. And then, I don't think you've had a urine drug screen in quite a while. We probably should do that just to.
Okay.
Is there going to be a problem there?
Maybe.
With something other than what you've told me? Are the substances there?
No.
Cocaine or other injectable medications? Anything else that you're using that you haven't told me about?
No, you're gonna take away my drugs.
Well, I don't want to take away your medication that you're on, but I think we have to have a pretty good idea if there's anything else going on there.
I mean, I guess I did a line of coke once. That's it.
Okay.
Once.
Okay.
One time.
Okay. So that's been quite a while then.
I hope it's been long enough.
Okay. Well.
Maybe
usually,
like 2 weeks ago.
Okay. Well. Okay. So we got to talk about that too.
I know.
Yeah.
I know.
So this is a little more complicated than what we thought.
Yeah.
Yeah. Okay.
So
Emily, it sounds like maybe we need to get you in to see a substance abuse counselor.
okay. All right. I know.
We've got to turn things around here a little bit.
We do. I know.
You're just on all kinds of prescription medications and some of these illicit things, and you're at high risk for some serious harm to yourself.
But at least I'm honest.
Well, I appreciate that. We need that.
Yeah.
If we're going to make any progress, we've got to have that.
Yeah.
So let's get a urine drug screen today. And
Okay.
I think that
All
what
right.
I'm going to do is I'll get you into pain management after we do the MRI, but for sure we want to have you see an addiction specialist to
All right.
talk about some of these things.
All right. We'll turn it around. We'll turn it
We're
around.
going to turn it around. I'm hopeful. I think you're going to do all right.
Okay. Because I don't want to live like this anymore. I don't want to do it.
That's all right. Well, I'll help you the best I can.
All right. Good.
All right.
We're gonna turn it around.
So let's go get that urine drug screen.
Okay. All right.